My name is Loubens, and I am one of the program director for 7elements. I want to talk about global health, and also I'm going to cover 5 topics that related to the global health. These are non-communicable diseases, pharmaceutical industry, infectious diseases, and the health crisis in Haiti and the Dominican Republic. Global health is the health of the populations in a global context. It has been defined as the area of study, research, and practice that places a priority on improving health and achieving health in a healthy way for all people worldwide. It should not confuse with international health, which focuses on developing countries and foreign aid. There are now more than 100,000 international flights every day, which means more complex infectious disease spread beyond national borders more quickly than in individual countries. But developing countries may not have the capacity to tackle the ever-evolving issues, which means people from different governments and cultures, religions have to work together to keep the public safe. Now we're gonna talk about the non-communicable diseases. Non-communicable diseases is a non-infectious condition that cannot be spread from person to person. It also lasts for a long period of time. This is also known as a chronic disease, as a combination of genetic, physiological, lifestyle, and environmental factors can cause these diseases. Some risk factors include unhealthy diet, lack of physical activities, excessive use of alcohol, smoke, and secondhand smoke. Non-communicable diseases kill around 41 million people each year. This is about 71% of all deaths worldwide. More than 85% of these deaths occur in low and in vulnerable communities where access to preventative healthcare is lacking. About 100 million people each year suffer financial catastrophe, and about 100 million pushed under the poverty line because of payment for healthcare. More than 90% of these people from in low-income countries. In Haiti, we have 2 non-communicable diseases that affect Haiti, or diabetes, which disproportionately affect low-income communities. Pharmaceutical industry is the part of the healthcare sector that deals with medications. This industry comprises different subfields pertaining to the development and marketing of medications. These more or less interdependent subfields of drugs manufacturers, drugs marketers, and biotechnology industry. The main goals of the pharmaceutical industry is to provide drugs that prevent infections, maintain health, and cure diseases. We're gonna take a look at infectious diseases, what they are, some terms used to describe them, and take a look at a few different types of infectious disease. But first of all, what is the infectious disease? Infectious disease is a disease caused by an infectious agent like viruses, bacteria, parasites, or fungi. Infectious diseases are a global problem and in the past used to be a leading cause of death. There were lots of pandemics like smallpox, TB, cholera, syphilis that caused millions of deaths around the world. In 1918, influenza pandemic alone were responsible for the death around 40 million people globally. Thankfully, advances in nutrition, antibiotic, immunizations, food safety, housing, and sanitation has led to a massive reductions in infectious disease. Addition to this, malaria and tuberculosis continue to affect millions of people. The new diseases like Ebola and MERS-CoV has sprung up, causing deadly outbreak and killing thousands of people. The intensifying social political crisis in Haiti is having a negative impact on the health of the Haitian populations. Haiti has the highest infant and maternal mortality. the worst malnutrition, and the worst AIDS situations in the America. The general mortality rate was 1,057 per 100,000 populations during the 1995 to 2000 period. It also the highest in the Americas. A quarter of the children suffer chronic malnutrition, 3 to 6% of acute malnutrition. About 15% of newborns have a low birth rate. Acute respiratory infections and diarrhea cause half of the death in children under 5 years age. There are complications in a quarter of delivery. The coverage of delivery is very low. 40% of the populations have no real access to the basic health care. 76% of delivery are made by non-qualified personnel. And more than half of the populations have no access to drugs, and only half of the children are vaccinated. Current intensifications of the crisis is accompanied by an increase of the violence, particularly during confrontations between gangs. Insecurity is higher in Atibonite and Central. That means there are demonstrations occasionally violent in the capital. To face the complex crisis and to respond to its mandate of defense on the public health, the PAHO and the World Health Organization's representations initiated a dialogue between the main partner in the health in the countries. In combination with the United Nations system, the country health authorities, the B, and the Multilateral Cooperation Agency and non-governmental organizations. Critical elements for the health sector: disregard for health institutions, neutrality, and immunity. Several hospitals were the targets of violence. Patients were assaulted in some institutions, and the staff providing care is worried about exercising their duty safely. In some health institutions, the staff does not go to work on the day of demonstrations. Some of the patients in need of emergency care do not go to hospital anymore for fear of violence. The Port-au-Prince of the University Hospital, one of the main hospitals in the country, has been almost at a standstill weeks for lack of personnel. Supply difficulty in health institutions. It's increasingly difficult to supply hospitals with drugs, medical surgical consumables, water, propane gas, and diesel. Stocks of drugs are not renewable and peripheral warehouses located in zones of difficult access. As a result, emergency care and other essential services are not guaranteed. Precariousness of the access to care. Certain hospitals strongly decreased their activity due to the lack of equipment and human resources. Most of those remaining operational are private institutions with limited access for the financially needed. Emergency care has also become the privilege of private institutions, and access to the powers is compromised. It has been reported that in some areas, home care has replaced hospitalizations for those avoiding hospitals. Problems for routing the injured and sick patients to hospital are becoming more acute, particularly in the department of Artibonite due to the lack of ambulance. Risk of a destabilization of the already weak healthcare system. Difficulties of access to certain zones complicate or impede vaccinations activities. This pocket of non-vaccinations may affect national vaccinations efforts of heighten the risk of recrudescence of outbreak of vaccine-preventable diseases. There has not been any notified case of measles or polio for 2 years, and the absence of cases could be threatened by an interruption of vaccination. Certain blood transfusion centers set up in different areas of the countries had to stop their activities, in particular in the zones of higher strength where they are most needed. The National Program for Tuberculosis and HIV/AIDS have reported difficulties in the follow-up of patients and fear and accelerations of drugs resistance in the long run. In Altibonite, a group of patients receiving antiretroviral drugs had to suspend their treatment due to a lack of access to the supplying institutions. Increase of emergencies linked to violence. The care of the injury saturates the existing capacity of emergency services. There have been reports of cases of unattended obstetrical emergency. On the other hand, some institutions suspect an increase in the incidence of rape. Most of the victims are not informed about the measures to take in those circumstances and do not have access to preventative treatments. Focalizations of the media on the crisis. The mass media report almost exclusively on the political informations and assign very little space to the other categories of informations. Health messages in support of disease prevention and control programs have become much less apparent. This is a problem since prevention seems to loosen in times of crisis, and the media coverage of these issues should be accentuated. Deteriorations of the potable water installations. Most hospitals are old, badly maintained buildings with decrepit water installations. Hydraulic pumps are often out of order for lack of electricity. The cities most affected by the violence, Gonaive and Cap Haitians, are supplied water through an electrical pumping system, and those two cities has been out of electricity for several weeks. The water distributed for the public institutions, it's only chlorinated in Port-au-Prince. Lack of precise information. The health effects of the crisis are not documented properly due to a failing routine health information system and difficulty of access to zones most exposed to the violence. This lack of information is a major obstacle to the elaborations of a response adapted to the needed arising from the crisis. Now we're gonna move on to the health crisis in the Dominican Republic. Social determinants of health. In 2014, there was significant income inequality, reflected in a Gini coefficient of 0.463. Almost 80% of the incomes receiving population earns less than twice the minimum wage from its primary occupations. It's estimated that the extreme poverty rate declined from 8.4% in 2014 to 6.0% in 2015. Between 85% and 87% of households, 90.6% in urban areas, and 75.7% in rural areas use an improved water source for drinking. An estimated 1 to 1.5 million Dominicans reside abroad, according to the National Immigrant Survey of 2017. The foreign immigrant population is equivalent to 5.55% of the total national populations. The survey is not determine the number of people living in the country without the proper documentations. The majority of disasters are caused by hurricanes and earthquakes, which have major economic and health consequences. Judge is also a critical concern. Health situations and the health system. In 2015, the maternal mortality rate was estimated at 92 deaths per 100,000 live births. Maternal mortality was concentrated mainly in 4 provinces: Santo Domingo and National Districts Santiago and San Cristobal. The same year, 78.6% of births were attended by trained personnel. Adolescent girls who are less educated, poor, and in rural areas are at the greater risk of pregnancy and have higher pregnancy rates. The adolescent pregnancy rate is twice as high in regions with higher female unemployment as the other regions of the country. Adolescent pregnancy is also associated with lack of access to reproductive health services among women aged 15 to 19. In 2015, mortality in children under 1 year was 22.9 deaths per 1,000 live births, 31 in urban area and 28 in rural areas. In 2012, disorders originally in perinatal period accounted for 65% of deaths in children under 1. Sepsis was one of the 5 leading causes of death in children under 5, with an even higher risk in children under 1. In 2012, traffic injuries were among the leading causes of death in the population aged 5 to 44. The 2 leading causes of overall mortality for over 45 age group were the same as for the general populations: ischemic heart disease and cerebrovascular disease. Between 2012 and 2015, BCG vaccine coverage was over 95%, and DPD3 coverage ranged from 82% to 90% in the under 1 populations. In 2015, 1 case of diphtheria was reported. None were reported in 2012 to 2014. Whooping cough prevalence increased with 69 cases in 2015. A cholera pandemic occurred in 2011 to 2012. In 2013, 539,000 cases of chikungunya virus infection were estimated. In 2015, the incidence of malaria was 1.9 per 100,000 populations. The populations at greatest risk of malaria are temporary migrant workers and in the agricultural and construction sectors. Canine-transmitted human rabies has not been eliminated in 2015. 2 deaths from disease were confirmed. Lymphatic filariasis is in the process of eliminations, as is leprosy, which has yet to reach a target integrator of less than 1 case per 10,000 populations in all municipalities. In 2010, the prevalence of hypertension was 34.6%. In childhood, obesity was 7.6% in 2014. 56.3% of adults were overweight. The health system is defined as a social security model guided by the principle of universal coverage. Compulsory enrollment, solidarity, comprehensive care, a on-field system, free choice, and gradual implementations among other legally recognized principles. In 2014, the country adopted a model of care based on the principles of deaf care strategy and the integrated health service network. The Ministry of Public Health has a governance rules and includes the National Health Service. In 2015, 65% of the population was enrolled in the family health insurance system. Of this group, 47.5% were covered by the subsidized regimen and 52.5% by the contributory regimen. Health expenditure currently represents 4.1% of gross domestic product. Public funding schemes 3.7% and private funding 1.4%. In 2011, there were an estimated 21.2 physicians and 3.8 nurses per 10,000 populations. The National Health Service has 1,450 primary care centers, 1,774 primary care units, and 189 specialized health care centers, including 13 regions hospitals, 35 provincial hospitals, 122 municipal hospitals, and 13 referral hospitals. These facilities have the necessary capacity to provide the care stimulate in the basic health plan, which includes a package of services coverage by the family health insurance system for members of the Dominican Social Security System contributory regimen. In 2015, the basic list of essential medicines was updated based on the World Health Organization's model list of essential medicines. Achievements, challenges, and perspectives. Between 2019 and 2015, the country made great progress in health and overall development. It's worth noting that infant mortality plummeted 50.3% in the period. Pending challenges include continuing with maternal and child strategies and programs to reduce under 5 and maternal mortality. Health insurance coverage in the country has increased substantially in the past 5 years, from 43% in 2021 to 65% in 2015. However, there is still a major gap for a significant portion of the populations. A significant challenge is updating the list of benefits that should be covered by the Dominican health system. This list should be based on these prioritizations and must be financially sustainable. Countries' health profiles suggest that main health determinants such as poverty, education, gender-based inequality, and migration should be taken into account in our side of prevention programs. The country also seeks to provide effective vaccination coverage in all territories and communities. Another priority is increasing access to antiretroviral therapy for the population living with HIV. Preventing and reducing non-communicable diseases require an intersectoral approach for the adoptions and standard and actions in areas such as smoking and full labeling to address the major risk factor in the populations. Some of the social and health determinants that affect adolescents indicate the need for state policies to address underage marriage, therapeutic abortion, and the lack of sex education. Outbreaks of cholera and drug-resistant tuberculosis are among the challenges that require joint effort with other countries in the region. The treatment of injury from external causes, substance use disorders, social violence, and the prevention of famine have become major public health concerns. It's critical to improve health, the birth certifications, structure, and registration systems, especially in areas with higher level of poverty and in border regions. An estimated 20.8% of the population aged 0 to 5 lack a birth certificate, which impedes the delivery of basic services and health planning. Thank you so much for watching this video, and I'm looking forward to have you here. And also, these topics, we just give you a little quick overview about it. But when you come here, we can discuss them in very deep.